So you talked about QEEGs in there. Maybe we can try to kind of simplify it just for people who are watching this that don't have that, technical understanding of it. So just real basic question, what is a QEEG?
So the Q stands for quantitative, and EEG stands for electroencephalogram. So it's your brain waves. And most people know that an EEG, you can go to the hospital and they'll record your brain waves. And doctors, neurologists will do EEGs. And so it's just the recording of your brain waves for a certain amount of time. The difference between a normal EEG at a hospital, historically, they use a pen and paper, and they're getting actually paper recordings of the raw waves. But what we've been able to do with the advent of computers is to, instead of having it come out on a piece of paper, is to put it into a computer file. And then with computer files, you can then pull it into a software that can apply 5,000 math algorithms to it and just spit out a report that gives exactly, we have brain waves that should be a certain height, like your theta should be 10 to 15 microvolts high. If it's 20, it can say, wow, your theta is 2 standard deviations above normal, right at this spot and at this spot. And then your beta is too high at this spot. And, oh, this particular wave meets the criteria for a seizure spike. It can use math to do all of that. And we're able to get instantaneously, not just looking at the raw, which is very important, but a whole lot of other information in a map that's visual, that people can understand, that shows pictures of the head of where things are dysregulated.
Mm-hmm. And so in kind of a psychiatric mental health setting, which is the setting that you and I both work in, having that really detailed information and those maps and those pictures of this region is dysregulated, or this is the really specific feature that we're seeing, how does that help you in your treatment in that setting? Or how would that benefit somebody who's coming in with a specific symptom, anxiety, or they've had trauma, or depression or OCD or whatever it is? You administer a QEEG and you get this picture that you're talking about. How does that help that person?
One of the main things that I've come to that we do with the QEEG is say, where are slow waves and fast waves too high? And how is that related to the symptoms you're coming in with? If it's depression, you've got slow waves on the front left, that can cause depression. If you've got frontal theta, that can cause ADD, ADHD. If you've got beta in the back, that can cause sensory issues and anxiety. So we are then able with neurofeedback to put electrodes in those places and reward your brain, teach your brain to suppress those to a normal level. And we know it's normal because we've got the QEEG in the databases. And so we're able to help that. And doing that immediately helps resolve those symptoms and helps your brain regulate better.